emergencies involving the eye in a workplace laboratory. Chemical splashes to the eye can cause irritation, burns, blurred vision, or even permanent blindness if not treated immediately.
The objectives of first aid management for a chemical splash are: first, to minimize eye damage by removing or diluting the chemical immediately. Second, to prevent further exposure or injury to the affected person. Lastly, to ensure timely medical treatment and reduce long-term complications.
Before the job, make sure you're wearing all required PPE and follow the laboratory safety procedures. One mistake can cause a serious injury.
No worries, I will be careful. Something splashed into my eyes. I can see properly. Help me.
Oh my gosh, Nadia, what's going on?
Stop everyone, stay calm. There is a chemical spill incident. Stop everyone, stay calm. There is a chemical spill incident. Step back everyone and leave the casualty some space.
The first step of drug is danger. Before approaching the casualty, the first aider must ensure the scene is safe for everyone.
Please step away from the area to avoid the chemical spill contamination.
I will make sure that no one enters this contaminated area.
Miss, have a seat. Miss, are you okay? Do you hear me? What happened?
My eye burns badly. I can't open it properly.
I know it hurts, but please do not rub your eyes. Please stay relaxed.
Yeah. The second step is respond. The first aider checks whether the casualty is conscious and able to respond. In this situation, the casualty is awake and responsive, but experiencing pain and discomfort.
I'm checking your airway now.
The third step is the airway. The first aider ensures the airway is clear and there is no obstruction, preventing normal breathing.
The airway is clear. Now I will check if the casualty can breathe normally.
The fourth step is breathing. The first aider checks whether the casualty is breathing normally by observing chest movement and signs of respiratory distress.
The casualty is breathing normally.
My eyes still feel painful. It's burning.
At this point, there are no breathing difficulties observed.
Now I'm checking for severe bleeding or any other injuries.
The final step is circulation. The first aider checks for severe bleeding, signs to circulation, or any other injuries requiring immediate emergency attention.
There is no severe bleeding and no additional injuries.
Since the casualty is unconscious, breathing normally, and there are no life-threatening conditions, immediate first aid treatment for the chemical exposure can begin.
I'm taking you to the eye wash station now. Can you walk with me?
I'll help with this. Let's move quickly. Let's go.
Slow, slow. Are you okay?
The RABC approach is important because it helps us to assess the situation systematically and ensure that the casualty receive immediate and appropriate assistance.
After completing the drug assessment and confirming there are no life-threatening conditions, immediate decontamination of the affected eye must begin as quickly as possible. Before assisting the casualty, the first aider must wear appropriate personal protective equipment or PPE to avoid direct exposure to hazardous chemical, which is gloves.
I will wear protective gloves to ensure my safety first.
In workplace emergency involving chemical, protecting both the casualty and rescuer is really important.
Please stay calm. I'm going to help you to open your eyes.
My eyes still hurt. I can't open it properly. Is it gonna be okay?
I know it's painful, but please keep your eyes open. The water needs to reach all of parts of your eyes.
flush out the chemical substance trapped in the eye.
I'm starting to rinse your eyes now.
The next step is to rinse the affected eye immediately using clean running water on an eye washing solution. Immediate irrigation is the most important treatment for chemical eye exposure. Flushing helps dilute and remove the chemical before further domestic cure.
Please continue naturally blinking while rinsing your eyes.
Flushing should continue for at least 15 to 20 minutes to remove as much as chemical residue as possible.
Keep blinking your eyes.
I will monitor the time for the flushing to continue long enough. Is it done? Continue flushing. Do not stop.
Okay.
The casualty is encouraged to blink while rinsing, allowing rays to reach areas beneath the eyelids where the chemical residue may remain.
How do you feel now? Is the pain reducing?
It is not as bad as before, but it's still blurry and still hurts.
Even when symptoms improve after rinsing, chemical injuries may continue to damage delicate eye tissues. Medical evaluation is therefore essential.
You have been done well, but this isn't over yet. We need to bring you to the medical professional to further examination.
Let's get you to the clinic immediately. We'll make sure that you receive a proper medical treatment.
Let's go.
This incident could have been prevented by following laboratory safety rules and wearing a correct PPE. Remember, safety procedures are there to protect us.
Professional medical treatment is necessary because some chemicals can continue damaging our tissues and alter their rinsing.
The correct first aid steps for chemical splash are: first, stay calm and do not rub the eye. Second, rinse the eye slowly at eye wash station. Third, keep rinsing about 15 to 20 minutes. Fourth, seek for medical attention as soon as possible. Also, these are prevention from chemical splash to eye in workplace laboratory. First, follow standard operation procedure that have been set in laboratory. Second, always wear PPE before starting handling chemical. Lastly, ensure that eye wash stations are accessible and fashionable in laboratory.
We hope this demonstration has increased your